Hello guys, welcome to my YouTube channel Info. Today we will talk about how to manage a stroke patient in emergency. First of all, like, share and subscribe my channel and don't forget to hit the bell icon. Now, whenever a patient presents to you with a focal neurological deficient in the hospital or clinic, focal neurological deficient can be unilateral weakness of the body, paralysis of the body, sudden loss of the vision, weird headache. All symptoms are focal neurological deficient that can be caused by stroke. The first thing you have to do is you have to order non-contrast CT scan. Taking contrast CT scan take time. Non-contrast CT scan give you result more rapidly than the other scan. We are trying to do is in non-contrast CT scan, we are trying to look at blood in the CT scan. If there is present blood in the CT scan, it points out towards the diagnosis of hemorrhagic stroke. If there is no blood in the CT scan, it is ischemic stroke. So we want to see whether there is blood in the CT scan or not, because both ischemic and hemorrhagic stroke have different management. This is CT scan showing blood in the brain. This white area show bleeding. Blood is white on CT scan. If blood on CT scan, it is hemorrhagic stroke, and you have to initiate your protocol for hemorrhagic stroke. The only thing that a clinician or internist can do in hemorrhagic stroke, they can lower down the blood pressure to decrease bleeding. Rest is the job of neurosurgery department, and they have referred the patient for neurosurgery. Either they will go for craniotomy, in which they open the suckle and decrease the pressure in the brain, or they go for coiling, they pause the coil and stop the bleeding, or they clip the vessel by opening the brain. So that is how you manage a stroke patient. Now we will talk about ischemic stroke. What if you see no blood in CT scan? What you receive CT scan like this, in which there is no white area, no blood, instead you see black area. This black area shows ischemic stroke. Usually you do not see any change in the CT scan immediately when the patient presents. These ischemic changes take hours to develop, and CT scan is mostly normal, but the patient is having a focal neurological deficient. The main purpose of CT scan was to exclude blood, to exclude hemorrhagic stroke. Now we know that focal neurological deficient is due to ischemic stroke, and we have to treat patient according to ischemic stroke protocol. Ischemic stroke can also present as this. You can see the dark area in the CT scan. This dark area shows the middle cerebral artery is blocked. Now, whenever a patient presents to you with ischemic stroke with no blood on CT scan, the most important decision that a doctor has to take whether patient should be given TPA or not. TPA is a tissue plasminogen activator. TPA breaks up the clot that is blocking the vessel. But when you are breaking up that clot in the blood vessel and reinitiating blood flow to the brain, there is always risk that the ischemic stroke can become hemorrhagic. By breaking the clot, that you can convert ischemic stroke into hemorrhagic stroke. So there is high risk that when you giving TPA, that ischemic stroke can become hemorrhagic. That decision is the most important. Usually, TPA is given to the stroke patient if they present within 4.5 hours of focal neurological deficient, or within 3 hours if the patient is diabetic and with focal neurological deficient. If the patient presents after 4.5 hours, if the patient has contraindication to TPA and you cannot give TPA to that patient is given aspirin. Now that is the emergency treatment that you can give to the patient. Now, same day or next day, you have to do certain investigations to find out the cause of stroke and to prevent reoccurrence of that stroke. In these investigations, the most important is ECG, in which you look for atrial fibrillation, you go for echo to look for clot, and you can go for carotid ultrasound to look for atherosclerosis. If you do ECG, you find atrial fibrillation, you will have start patient on anticoagulant. In anticoagulant, you can give warfarin or any other novel oral anticoagulant drug. Blood pressure control in acute management of ischemic stroke is very important. While in hemorrhagic stroke, we lower down the blood pressure But in ischemic stroke, we do not lower the blood pressure very rapidly and we let the blood pressure stay high. That is called permissive hypertension. Why do we allow the hypertension to stay high? Because the blood vessels that is blocked, the high blood pressure is the adaptive mechanism to push blood through that blocked vessel so that the dead area is receiving little bit blood due to this high blood pressure. Thanks for watching this video.